Hello, this is Dr. Dylan. This is a brief presentation on coronavirus infection in humans. Presentation divided into 4 sections: background, symptoms of infection, treatment, and preventative measures. Coronaviruses are common viruses that cause infection not only in humans but also animals such as cats, cattle, camel, and bats. 7 strains infecting humans have been identified, causing flu-like illness similar to the common cold. Majority of the people have mild to moderate symptoms and they recover without any issues. Generally speaking, animal strains of coronaviruses do not infect humans, except in rare cases when those viruses can evolve or mutate, and then that leads to human infection. This now brings us to the first case of animal coronavirus infecting humans, 2003, the SARS virus, which stands for Severe Acute Respiratory Syndrome virus, which had a mortality rate of 10%, spread to humans through civet cats. Then in 2012, the MERS virus, Middle Eastern Respiratory Syndrome virus, which had a mortality rate of 50%, spread to humans via camels. Now we have a current situation. The new virus called the novel coronavirus, the infection started in Wuhan, China, apparently in the Hunan seafood market. The Hunan seafood market not only sells seafood but also various wild animal meats ranging from hedgehogs, foxes to monkeys. The current outbreak has now spread to other parts of the world, affecting so far a total of 14 countries, total of 2,840 cases as of Monday, 27th of January, 81 deaths, and 5 cases in the United States. Now, let's talk a little bit more about the symptoms of coronaviruses. As we said previously, symptoms of coronavirus infection are similar to flu-like illness, which include cough, fever, runny nose, sore throat, and generally feeling unwell. These symptoms are related to infection of the upper respiratory tract, which includes nasal cavity, sinuses, and the throat. As we alluded to previously, majority of the people have mild to moderate symptoms and they recover without any issues. Now this is related to coronavirus infection in general. What we don't know about the current virus, the novel coronavirus, is how contagious it is and its effect in terms of morbidity and mortality. So if you think you have the current virus, you should seek medical advice, medical attention, no matter how mild the symptoms may be. Sometimes in elderly individuals, coronavirus infection can lead to infection of the lower respiratory tract, which is the bronchi and the lungs, leading to pneumonia and bronchitis. And one notices that the symptoms of breathlessness continue to worsen. And if that happens, one should definitely seek medical attention. Treatment is symptomatic. There is no vaccine, so one has to treat fever, sore throat, cough, and take plenty of fluids. Now remember, do not administer aspirin to children or teenagers. It's contraindicated. Take plenty of fluids because when you have fever and respiratory tract infection, you have increased insensible loss of water through the respiratory tree and through evaporative water loss from the skin. Sometimes you may need antibiotic therapy even though you have a viral infection. That's because even though you may have a viral infection in some individuals, uh, um, there can be a secondary bacterial infection because they are so debilitated. If that is the case, your doctor will do the appropriate tests and will give you appropriate antibiotic therapy because you may have pneumonia or bronchitis secondary to bacterial infection. Preventative measures. Remember previous coronavirus infections in 2003 and 2012 were severe. These were infections in humans from animal source, and they were controlled with appropriate preventative measures. So we should be able to prevent the spread of this current outbreak with appropriate preventative measures and through practicing good hygiene. Coronaviruses are spread through respiratory droplets, so if you cough and sneeze, please cover your mouth with paper towel or tissue paper and dispose of it immediately. Wash your hands for at least 20 seconds with soap and water. Avoid close contact with others. If you're in a crowded situation, use face masks. And if you think you've come in contact with someone who has the novel coronavirus, which is causing the recent outbreak, seek medical advice immediately and tell them your source of contact. If you've traveled abroad and you have flu-like symptoms and you're worried, seek medical advice. And that's it. Stay safe, take care. If you like the current presentation, please subscribe to the channel so when I upload more videos on this topic or other important topics, you will be notified. Click the bell icon and share this video with other people so we can spread the word on how to take measures to guard against current outbreak of animal coronavirus infection in humans. Stay safe. Thank you for listening.